If you care about helping the community, you're going to want to be a part of this team. Find out what it's all about. Coming up next on Carolina People. Good morning. Welcome to Carolina People. This morning we're at the Murrells Inlet office of America's largest telephone cooperative, HTC. We're focused on Care Team, and we're visiting with its executive director, Johanna Haynes. Good morning,
yes,
Johanna.
Thank you.
Thanks so much for coming in. A great opportunity to finally get you in. More than a year and a half we've been back on air and still hadn't gotten you in.
Yeah, well, thank you very much. Glad to be here.
A lot going on in Horry, Georgetown, and Williamsburg counties.
Yes.
3 big counties. When you think about geographically, the largest county in the state, the 4th largest county in the state, and Williamsburg's either 3rd or 5th largest in the state. You've got 3 of the top 5 geographical counties and a lot of diversity in the counties.
Right, create some challenges, but I think we're doing a good job.
I bet. You're on the road a lot, Johanna.
Yes.
Yeah, you're on the road a lot. For viewers who may not be familiar with Care Team, what exactly is Care Team?
Care Team is a nonprofit organization. We're the local HIV/AIDS service organization for Horry, Georgetown, and Williamsburg County, as you mentioned. And we do 2 primary things. We provide direct services for people who are living with HIV, making sure that they have medical care and treatment for their HIV disease. And we also provide free and confidential HIV testing, counseling, and education programs to help people understand HIV and the risk for HIV in our area.
Are there big risks? I mean, is this something that folks really need to be concerned about? Obviously, they have an executive director of a nonprofit organization. They probably wouldn't have you in this place if it wasn't a big deal. But is this something that everyone needs to be thinking about?
Really, it is. Care Team's been in existence since '93.
Right.
And I think one of the challenges for us today is that the face of HIV has shifted. Where most people still think that HIV is a gay man's problem, that's not really the case today. Over half of our new infections are people who are heterosexual. We have
over half of new infections are heterosexual?
Yes.
Oh, Lord.
Yes.
Wow.
Folks also think that HIV is, it's a drug user's problem, and yes, but less than 7% of our clients have drug problems. So, as the disease has started shifting, people are still thinking of it in old terms, and that's the frustrating part. And I think that that's what's creating the infection rate climbing in the South, particularly in South Carolina. Nationally, the infection rate for HIV has started to decline some.
Is that right?
Good. Slightly.
Yeah, good.
It is good.
I'm sure you're thrilled, yeah.
Absolutely. In the rural South, though, it's climbing. And it's climbing because we have a group and community of people who do not think that HIV is an issue for them. And because of that, they're not taking care of themselves and being careful.
Right.
Particularly in the African American community today, HIV is a serious problem. 73% of new infections are African American, 83% of our female infections are African American. And again, it's a challenge to get into the counties because they're so large and really provide the education to help folks understand that HIV is an issue for them and that they're at risk.
How do you get to folks in the African American community to let them know that?
Well, we started a little over a year ago working through churches. And I really think that that's the best way to communicate, particularly with the African American community, very family-oriented spiritual community. And so what we thought is that if we can get churches to help start educating, that would be the fastest way to do that. And it has. It's been very successful. I think oftentimes church leaders initially are kind of, we don't come, we don't want you.
Yeah.
But what we want to do is help them develop educational programs that fit their church and their teaching. We don't have to come in and talk about condom use and safer sex. We'll get churches to talk about the risk because the risk is very real. And once someone knows the risk, I think, then they can take care of being careful and taking care of themselves. But I think just knowing that the risk is the most important thing right now. So.
And but that the rates are rising so dramatically in the heterosexual population. I mean,
Yes.
clearly they're beyond that on the risk talking points.
Right.
They're not necessarily talking to the homosexual community. They're talking to both communities there. I mean,
Both communities.
Everyone
Yes.
is capable of having
Yes.
listening to the same talking points.
Yes, and I think, Greg, that we're at a real crossroads right now with this disease. And probably not you or your viewing audience has occasion to spend much time in the gay community. But if you did, the first thing that you would notice is that there are not many older gay men. And they're not here because this disease ravaged that community very early while we're still trying to figure out what it was and what caused it. And so we weren't paying attention. Our government wasn't paying attention. We didn't reach out and try to figure out quickly what was going on and try to find a solution. I think the same thing is happening now that the disease has shifted. The face has changed. Affecting the heterosexual community, yes, African American community, but 11% of our new infections are people over 50.
That's
and those
incredible.
Are heterosexual.
I heard you share that recently. 11% are over 50, and almost all
heterosexual white people.
Right.
Yes. So, what I'm fearful of is that if we don't start getting a handle on this now, and stop trying to make this somebody else's problem, or this doesn't exist in my community, this is a problem that's in Africa. If we don't start paying attention to that, my fear is that 20 years from now, somebody else will be sitting here saying the same thing about the African American community, that we're going to look out and that there aren't going to be a lot of old African Americans. And I want us to take some really positive steps right now to help the community understand that the risk is very real. We've looked at statistics, from national statistics with HIV prevalence. Over 1 in 297 people have HIV nationally. Nationally, though, the African American population is less than 12%. Well, here it's over 30%.
Wow.
And so if you look at national statistics and population and percentage of African Americans in our population, the really scary thing is that we believe right here in our community that probably 1 in 100 African American women have HIV, and most of them don't know it.
In the Horry, Georgetown, Williamsburg counties,
Yes.
that 1 in 100 African American women would have HIV
Yes.
and not know it.
Yes, because they're not looking for it, and they don't think that it's an issue for them.
And these are most predominantly heterosexual women.
Absolutely heterosexual
And
women.
they have most likely gotten it through
Heterosexual partner.
Okay,
Yes.
through a heterosexual partner and an unprotected. I mean, there are still ways to try to not get HIV. Is
Right.
the most probable way using protection. And
Right.
this is a 7 a.m. community fair show at Thursday morning, so obviously it's just important to get the basics
Right.
across. I mean, how can viewers make a difference, Johanna?
And it is important. It is so very, very important, because if someone doesn't know their risk, they're not going to take care of themselves.
Right.
But the really thing that breaks my heart, the really scary thing, is that we're over 20 years into this disease. We know what it is and we know what causes it.
Right.
We know how to prevent it. But if you don't think that you're at risk, you're not going to do anything to prevent it. And so it's really important that we get the message out. And this is not, like I said, we're not talking about a gay man's problem isolated anymore, really infiltrating the heterosexual community and African Americans particularly. But we're not talking about either, a group of people that the people that get infected, well, they're, drug users or they're sexually promiscuous. That's not the case. It only takes one experience.
Just one time,
to be infected with HIV. And so, I always say that the difference between me and someone who has HIV is really just the grace of God. It's not behavior differences. I talk to very few people who can say to me, I've never made a bad choice or something I would have done differently in a sexual relationship. So, we're talking about people like you and me, just living our lives and not really understanding how this disease impacts us.
How did we get to that 11% figure for heterosexual, oftentimes white persons over 50? How does that figure get so large? I mean, how did that crop up? As you say, I mean, and that could, that's obviously risen exponentially.
Absolutely. And, you know, I think the issue with there, and lots of people in this business of HIV really believe that, you know, what we're looking at is a very high divorce rate among Americans.
Right.
And people tend to start getting divorced after their kids leave home.
Right.
And so that's about the time. And the last time, you know, we were out in the dating community, we didn't have to worry about things that could kill us.
Right.
We were worried about other things.
Yeah.
That had quick fixes.
Right.
You know? So, again, just really important to take care of ourselves. Know that we're at risk.
Right.
That's the number one thing. So.
Then if we could just say that over and over for the next 20 minutes, suppose anything else, just know we're at risk. Know you're at risk, whoever you are watching.
And if you know that you're at risk, know your status, because knowledge is power. Okay?
Obviously, you know, a lot of folks don't want to know. They prefer not to know, but at the same time, they're going to impact other people for the rest of their lives if they don't want to know and they actually have HIV and they're spreading that through unprotected sex potentially. Then they're really going to take a lot of other lives, take them down with them. And unless that's their goal, then really they need to get checked out.
Right. And, you know, it's not about one person, you know, being promiscuous and sleeping with a lot of other people. You know, you sleep with one and that person sleeps with someone else, and that's the way it gets passed.
Domino.
So, you know, you bring up an interesting point, too. So often I hear people say that they don't want to know. You know, my God, if I find out I'm positive, well, you know, I'm going to die anyway, so I'd rather not know for the rest of my short life.
Right.
That's not the case today. You know, 20 years ago, if you got diagnosed with HIV, you had a life expectancy 6 to 18 months.
Right. Yeah,
You
Magic
very
Johnson's
quickly.
going pretty strong, isn't he?
Absolutely.
He is HIV positive. He is HIV positive, and he is known for almost a decade or so, right?
Absolutely.
And he is doing okay? I mean, how has
He's
that
doing
impacted
great.
his life?
The medical community now sees HIV as a chronic illness, not a terminal one.
Wow.
So with early detection, get tested, and early treatment, HIV is a chronic disease. It doesn't mean that it's not a difficult disease to live with. The medications are very powerful and they shock your system, and side effects are often not pleasant.
Right.
But that's where an organization like Care Team comes in to kind of help folks through, particularly the early stages of treatment, when those side effects can be more severe. But, you know, and I've heard people say, you mentioned Magic Johnson, oh, well, he's doing so well because look at how wealthy he is. Look, he's got access to all of this great treatment.
Right.
Well, not just Magic Johnson. That's why Care Team exists. Anyone who has HIV and wants treatment gets it. Probably 2/3 of Care Team's clients are people who have no insurance, no public or private insurance, particularly in our area with service industry, seasonal employees. Lots and lots and lots of our employees in Georgetown counties don't have medical insurance with their jobs.
Right.
And so treatment is expensive. Those people need help, and that's what we're here for.
This is very serious. I mean, as you think about it, does Care Team have government support? Is it locally funded? How do you all have enough money to provide the counseling as well as all the testing that's involved, and how simple is the testing? But real quick, I don't want to get to those. If a viewer needs to get off to work now or get family off to school, is there a good phone number, and do you all have a website?
Absolutely. Our phone number is 236-9000.
Okay.
You can call to get information anytime. You can call to schedule an HIV test. We'd be happy to do that.
Okay.
Our website is careteamsc.org.
Okay.
It also has a lot of information about what we do and how to get in touch with us for specific things.
Okay.
So,
and for our viewers in the PD, you've got a sister or brother organization in the Florence area that if they called you, obviously you could help get them in touch with.
Absolutely. There are 11 other organizations like Care Team in South Carolina.
That's
and
great.
we also cover several states.
843-236-9000 or careteamsc.org. Okay,
Yes.
well, let's get back to how easy is getting checked out.
That's the great part. They have a test out now that is non-invasive. It's an oral swab. You don't have to do a blood test. And the test is very accurate. We've never had a false positive so far. You can get the result in 20 minutes. Mm-hmm. So the length of time that you and I have sit here and have a conversation about HIV,
right.
you would have a result of your test.
So almost always folks will wait there at your offices, but it's very confidential. I mean, they could be sitting in the lobby and no one knows that they're sitting there waiting for their test results.
Absolutely.
Right. Very confidential.
What we've done in the last few years is take our name off the door.
Right.
And get it out in the community. People don't need to know where we are unless they need us.
Good.
But everybody needs to know that we are and that we're here to help.
Good for you, Johanna. That's smart.
I think that's important.
Right.
Confidentiality we know is important to everyone, and we want to provide that. So, you don't want to go to your doctor's office and be tested. You don't want to go to the health department and be tested.
Right.
You can come to us, and we'll take care of that. We also have a satellite office in Georgetown,
Good.
so you wouldn't have to come to Myrtle Beach to get a test if you want to do that.
Again, very confidential. What about money? How are you all funded? And are you ever looking for donations? And what's the best way for folks to make them if you are?
Right. Primarily, we're funded through federal grants.
Okay.
And I have folks ask me all the time, why does the federal government give so much money to HIV? And there are so many other diseases that don't get as much. The issue is that this is an infectious disease, and it spreads.
Yeah.
Okay, and so we make sure that people get treatment, they don't end up really sick and in the hospitals, and that they're living productive lives and out in the workforce, not on disability and stuck at home dying from a disease. We want folks living good quality lives, and so that's what we're doing. That's what the federal government is helping us do, to decrease the risk of infection with other folks and to help people live productive lives. So most of our funding comes from the federal government, but like everyone else, it's not ever enough. And those funds are very restricted too. There are things that Care Team does that are real important that the federal dollars don't provide. Things like transportation, especially you're talking about county.
In our giant rural areas, someone in King Street who needs to get over,
We can get people into medical appointments, but we can't get people into, support group appointments or mental health or substance abuse counseling appointments, or, the federal money is very restricted about how we can use it. So, it's important that we have funds that help us move in that direction. Our federal dollars also don't support faith-based programs.
Right.
So for us to get in and help churches out, those funds come from some private foundations, private donations, and they're really very important.
Good.
And have been very helpful.
Good.
What we've tried over the last year is to meet with groups of ministers in different communities for them to sit down together and talk about, what the issue is, and it's in our community, and how do we bring this into church without, getting people all stirred up and we don't want to hear about that. Again, folks don't want to hear about that because it's a gay problem.
Yeah, and I'm sure
if it's not, so we get the church leaders to understand the problem in their community, then helping them do the education. We don't have to do that.
Yeah, this is really everyone's problem, because I'm sure you probably find a lot of businesses that may not support because it looks like they're just catering to the gay community or something crazy like that they're really not going to be active helping Care Team out because it may be perceived the wrong way, even though you've made very clear this is not a gay man's disease necessarily. Obviously, there are gay men that are impacted by HIV.
Right.
Clearly. There was some other critical point that you made, and just trying to think that through. I'm sorry I got distracted for a second. I was just thinking about those businesses, but the basics of if I was HIV, if I wasn't taking any medication to slow it down, how soon would I lose my life in most probability? I mean, how quick is it deteriorated versus a Magic Johnson or versus someone who is actively, or any numbers of your patients,
Right.
clients?
Well, HIV is the virus that causes AIDS. Okay, HIV is the virus that attacks your immune system. You don't die of HIV.
Okay.
You die of other things that your body couldn't fight.
Okay.
Because HIV has destroyed your immune system.
Right.
AIDS really is an old diagnosis. It was used and identified by the CDC back in the mid to late 80s, excuse me. Because if you came in and your immune system was down a certain level and the amount of virus in your system was up really high, you really didn't have a lot of time to live, 6 months to 18 months.
Right.
Now that diagnosis is not quite as relevant for us because you can come in pretty bad shape, get on medications, take them correctly,
Right.
you know, stay in ongoing medical care, and do really well. So that's the good news, and we want to make sure that that happens.
Okay.
You could actually be infected and be HIV positive for years, though,
Right.
before physically you start
Before you
feeling
start.
the effects of HIV in your system.
And the most noticeable physical or external effects you're going to see are there, was it Philadelphia, something you would perceive the Tom Hanks character, I guess, with lesions or other, or maybe that was all blown out.
Not
yeah.
as common anymore.
Right.
Of course, they still exist, but they're not as common
Sure.
anymore. Most often, and this is scary too. Most
Right.
often, people don't find out that they're positive until they end up in the hospital really sick, and they have an illness that is most identified with HIV infection.
Right.
You know, certain strain of pneumonia, that kind of thing. But we want to try to catch people long before they get to the hospital to keep them, the virus, from destroying their immune system. You know, you in medical care and take medications like you're supposed to,
Right.
you know, you probably have a better chance being hit by a bus and crossing the street than dying
Wow.
from HIV. Taking care of yourself. And that's the message that we want to get to people. Know your status. Your
Right.
status is power. That knowledge is power.
Wow,
Because
wow.
get in treatment, take care of yourself,
Right. Know
and you're going to
yourself.
live a long life.
We've just got 3 minutes, Johanna, and if you were, surely I'm sure you do elevator speeches, but I mean, just getting the point across, I think you've laid out a lot of critical ones. Knowing yourself, just having to know, I mean, having to find that out, but ultimately, you've got some people who found out. I mean, what are some of the examples, just so that folks know, I've got to get in there and get that testing done. I want it to be confidential. I need to get checked out, but ultimately they could live, as you say, a long, long life. I mean, if it was just determined in the mid-'80s, you don't have examples of folks living more than 20 years, for instance,
Right.
after they've contracted HIV. But is the expectation that, and what is the medication itself? What are the most popular forms of medication that are going to help save putting off the deadline?
Well, medications have changed a lot and they've improved greatly. Early on in the stage of the disease, you could take 30, 50 pills a day for HIV, and they've gotten single doses and
Really?
2 doses a day
Yeah.
now. So the medications are much easier to take. They still have pretty bad side effects, at least initially. So we want to make sure we help get people through that part. But staying in medical care is really important. You know, if I was in and out of medical care, didn't take medications the way I was supposed to, what's going to happen is my body's going to feel resistant to those medications. So what that means is that if I'm infecting someone else with HIV and I'm resistant to these 10 medications, the person I infect is also resistant to those medications. So we make sure that folks really take medications the way they're supposed to.
And for folks who are HIV positive, if they are maintaining their, I don't want to say promiscuous, but their unprotected sex life, is it most probable that they are going to pass on the HIV, or is it just something that's rarely passed on? I mean, is that...
You know what? People with HIV and who know they are HIV, they're not the people that are out spreading the
Oh, I
disease.
understand. Sure, I'm thinking
It's the
more about,
folks
as you
that
say,
are-
the know yourself who don't know. Yeah.
Don't know their status.
So is it
They're the
probable
ones that are
that
out
they are
there.
right? So it's,
Yeah.
I guess it's then difficult to gauge whether or not it's passing very easily. I mean, is it an easily communicable through unprotected sex?
It is. Without getting a lot of detail,
yeah.
certain sex practices have more risk than others, but all of them have risk.
Right.
So it's easier for a man to pass it to a woman, and that's why it's so high in the African American female population right now. So.
careteamsc.org has some good info about it.
Yes.
Picking up the phone, 236-9000, whoever's answering there is pretty skilled, and someone called now and left a message and y'all called back, they could answer some basic questions.
Absolutely, and we will ensure confidentiality. That's our business.
Those are great words. Johanna, thanks so much for being with us this morning.
Thanks for having me.
Absolutely. Stay tuned to more Carolina People with Johanna Haynes of Care Team coming up next. You didn't hear us talking about pets this morning, did you? I didn't either. We weren't really getting into that, but I love that great acronym. It is a great one. I'm sure Johanna knows what I'm talking about. It. She may not have thought we'd get into it this morning. Prevention, education, treatment, and support. Think about that, PETS, prevention, education, treatment, and support. But you got to know yourself. Didn't you love that bullet point? Know yourself. 843-236-9000 or careteamsc.org. Take the time to go online. They've got tremendous frequently asked questions, a lot of great info. Johanna shared off camera. If you want to make a donation, you want to target it to a particular thing, like reaching out into the African American community or making an impact on young adults or on teenagers or otherwise, you can be a part of this. 843-236-9000. But what a great, simple mission to empower our community, Horry, Georgetown, and Williamsburg counties, with the means to stop the spread of HIV through prevention, education, treatment, and support. A couple other great things. This is an infectious disease, and it spreads. It spreads, but Care Team wants to make a difference and make a difference in your life. Know yourself. Give them a call, 236-9000. Johanna, thanks so much
Thanks for having me.
being with us this morning. Absolutely. Yeah.